So we are recording. Okay, well, I'm Joy Hogue. I'm the Executive Director of Families as Allies, and thank y'all for all being here today. And so we have a small group, so that means that there could be lots of interaction. And what we're going to be talking about today is we're right in the middle. We're actually coming towards the end of Mental Illness Awareness Week. And I think tomorrow's the last day. And also World Mental Health Day is this Sunday. So we're going to talk about both of those things. And there's been a fair bit about information and resources shared this week about both of them. But we want to look at them from the standpoint of how can we take those things that we're learning from Mental Illness Awareness Week and World Mental Health Day and to make things better for our children and our system. We always like to start with our goals so that you know what to expect, and we can look back at the end and see if we actually accomplish these things. So that all of you here today will be able to list, and we're not going to quiz you at the end, but in your head, be able to list 2 reasons why Mental Health Awareness, and it should be week, and World Mental Health Day are important. So why are we even doing this? Why does this matter? And you'll be able to identify 3 reliable online and in-person resources for getting more support for treatment for mental illness. Because this presentation hopefully will make you think about some things you hadn't been thinking about, and it may make you aware that you or someone in your family, or especially your child, might need some extra support. So we don't want to leave you hanging. We want you to know, where can you go to find some of that, to get more information. And you'll be able to describe the role of screeners. So that means an online screening you can take in getting help for mental illness, and that you'll be able to describe how the principles of the World Health Organization's Comprehensive Mental Health Action Plan apply to issues in Mississippi. Now, that's a really huge one, and looking at that plan and some of the things it implies, my mind is still spinning, but I think there's some things we can grab onto in there that are really practical that can help us look at what's going on right now in Mississippi and how can we use some ideas from that plan to move things forward for our children and for all people with mental illness and their families. So I think all of you are familiar with Families as Allies, but we always like to review who we are in case there's someone watching who is not, and also so everyone watching can keep us accountable for doing what we say we're supposed to do. So we're the only statewide organization run by and for families of children with behavioral health challenges in Mississippi. So all of our staff who work directly with families and most of our board members have raised or are raising a child with some sort of mental illness or with some sort of mental health challenge. It might be a child who has an actual mental health diagnosis. It might be a child with another kind of disability who in coping with that has had mental health challenges or has mental health challenges, a child who's experienced a lot of trauma. It could be a child who is affected by the juvenile justice or child welfare system, and in negotiating all those things, it's become apparent that either what led to that or as they have dealt with those issues, they've had mental health challenges. So it can be any of those things. And anyone who self-identifies as being a parent of a child or a caregiver who is someone other than a parent who's raising that child is welcome to be part of our organization. So as parents and caregivers, we support each other and work together to make things better for our children. And our vision is that all children will have the opportunity to reach their potential and succeed. And our mission is that families are partners in their children's care, so that families are partners in everything that happens. And we're not saying we make families do stuff. We're saying we recognize that's the role of families. They already are the most important partner in their child's care, and they should be recognized that as they negotiate systems and advocate for what they want for their children. Our core values define us. We value every child and family. So again, if you self-identify as Having a child with a mental health challenge, you're more than welcome to be part of us. We value excellence, partnership, and accountability. And these are all things that we value and strive for in ourselves and in our organization, but also as we partner with the systems that serve our children to demand that they adopt those core values too, because we feel like those core values are what will move things ahead for our children. You can see our contact information at the bottom. If you're on here, you probably are already on our email list, but if you're not, you can text 22828 to family 19 and get on it. And you can contact us at info@faams.org if you have more questions. When we talk about our mission and families being partners in their children's care, what we really mean is the system of care for children's mental health, or really for children in Mississippi, will be family driven. But a lot of times people don't know what that means. This is the nationally accepted definition of family driven. And all of our work, including this webinar, we want it to go through this lens. So we always want to make sure that people understand what we're talking about on family driven. Family driven, and I'm not going to read all these slides to you, but this one's really important, means families have a primary decision-making role in the care of their own children. So they're a primary decision maker, regardless of the services their child is getting. It's not that all these other people are making decisions for them, that they're a primary decision maker. And that not just for their own child, but as well as for the policies and procedures governing care for all children. And that's locally, at the state level, and nationally. And it includes things like being able to choose culturally and linguistically competent supports, both for their own child, and then at the systems level, making sure those things are available for all children. Setting goals for their own child and also for the systems that serve their children. Designing, implementing, and evaluating programs. So we shouldn't be having services and programs thrust on us. We should have these systems partnering with us to design, implement, and evaluate the kinds of things that will actually help our children. Then families should be involved in monitoring the outcomes of all of these things and partnering in funding decisions. Like, is money going towards what will most help our children? Now, I will give you a hint, or just a little hint of things to come. That these ideas will probably come up again later under a different umbrella in this presentation. These are the things we believe about families, that families, not us, not anybody else, know their children better than anyone else does. They're their child's strongest advocates. So we're not one of those, I think sometimes we're perceived as this 1-800 dial you an advocate place. We are not that. We advocate with families to get what they want for their children because they know their child better than anyone, and they're their child's strongest advocate. Sometimes they feel very beaten down by things that have happened to them, but we know, and we know they know, that they are their child's strongest advocate, and being supported in that so that they can advocate for what they want for their child is going to be what is most helpful to that child. We also believe systems should follow laws and policies about families and children's rights. And in this particular webinar, towards the end, we'll be talking about some really interesting policies that are not just in state policies or local policies or national policies, but there are some policies that countries around the world have come together and said, including the United States, I believe, we agree with this. We think these are important things that should happen in all countries related to mental health. Okay. Now, going back after that brief review to these things, these goals, why, when you think about it, and you can put your answers in chat, why does it even matter to look at Mental Illness Awareness Week and World Mental Health Day? Why does stuff like that matter? Why should we even do that? What are your all's thoughts? And I'm going to give everybody a chance. Excuse me. I was trying to go to chat. I went to my next slide to put your thoughts in chat about why does this matter? Why are we even talking about this stuff? Or does it matter? And when you do your responses in chat, please do to to everyone. So why does looking at this matter? And I'm going to call names if I don't start seeing things in chat. Good point, Karina, to make people aware and understand this. So mental illness is a thing. Yeah. So people won't feel alone. Very good point, Henry. Yeah, all people, great point, Jackie, deserve to be treated with respect and dignity. Yes, they absolutely do. Excellent points. To make sure people are important. People should be the first thing, right? Good point, Venice. That's what matters. And we hear a lot about person first. And a lot of times that's related to how we use language, but it's really a good philosophy overall to make sure that we're keeping our eyes on things in a way so that each person knows they matter and they can get what they need. Okay. Well, this is always interesting to see people's ideas and to already have a slide that has some other thoughts on it. But these are some, in preparing this, some things we came up with about why these kinds of days and weeks are important. It increases awareness and knowledge about mental illness. There may be people who don't know it's a thing. And we're going to talk more about this one. And this is something that usually gets thrown out there. And it's interesting to me that no one put this in there. And I think that may actually be a good thing as we talk about this more, but it decreases stigma. We're going to come back to that. So it's decreases the stigma of mental illness. All right. It makes it more likely people will get help. Because if they're saying, if they're aware of what mental illness is and that it's a thing, and they know more about what it looks and feels like, they might realize either they are affected by it or someone they know is, or someone they love, and they can get that help. It informs the bigger system of what is needed. Now, the system has to be listening and the system has to want to know. But during awareness weeks like this, there's a fair bit of information that's shared about what people are actually experiencing. There's a lot of statistics that are shared. What does that mean about how things need to be set up? Another reason it's important, mental illness, our brains are pretty complicated, and mental illness is an illness like anything else. It affects the brain, affects an organ in the body, but the brain is pretty complicated and it can look different. Mental illness can look different at different ages and in different cultures. A child who is 2, who is doing certain things, like having temper tantrums all the time and saying no all the time, they're acting like a normal 2-year-old. If somebody is doing that when they're 12, that's not typical. So it may mean that they might be having some mental health struggles. A child, who's 4 or 5 may have an imaginary friend and talk to them all the time. That's okay. That's pretty typical. But if somebody's doing that like when they're in their 20s and they think they actually, are hearing that person talk to them, that could be an indication of mental illness. So, and also mental illness can look different based on cultures. Like some cultures have kind of spiritual beliefs that some people might think have to do with mental illness, like something like speaking in tongues, but that is part of that cultural belief. That does, and we wouldn't want someone to come in and say, well, everybody in that culture, everybody in that church must have a mental illness because they're doing that. That is part of their culture, and it's an accepted norm within that culture. It's not our place to come in and decide, but there still could be someone in that group who has a mental illness And we would want to get this information out to all groups so they can look, because mental illness is common. How does within that culture, how could they take this information and not use it in a way to discriminate because they understand their culture, but also see if there are people who could benefit from more support. And then the very nature of mental illness can make it hard to identify. It affects the brain. So that makes it more complicated. And the brain itself can make it hard to know when someone has a mental illness. It can make it hard for them to know that they have one. And sometimes that's labeled as, well, they're just in denial. That's possible, but it's much more likely that they literally cannot tell, because the part of their brain that would allow them to be able to tell that they are different is one of the things that's not working. So it's not going to help to keep like pushing things in their face or that. It just makes it hard to identify. Also, there's some things that seem like they would be obvious, like depression. It seems like, well, everybody would be able to tell what that is because they're going to feel sad all the time. That may or may not be true with that particular mental illness. It's very common for things like difficulty concentrating or just being really tired, not being interested in things, for depression to present that way. And that person may just think, oh, I seem a little off. And maybe even the people around them are thinking, oh, he's just not himself today. He'll be okay. So, but if that persists, it could very well be depression, but it's not necessarily presenting the way people think it typically presents. That person may not be acting sad. They may not be crying. They may just be acting very different. So again, it's complicated. So weeks like this, where there's this opportunity, and we have these opportunities all year round, but where we're reminded of how important it is to look at these things, can be really helpful. Now, I want to get back to this idea of decreasing stigma and what that really means. And I just want to know from you, now you guys are really good in the chat box before, so now we're going to go to the next chat question. And I want you all to tell me, the term decreasing stigma comes up a lot with mental illness. And I just want to know what that means to you. And we're going to see in our discussion today if we might be able to expand our horizons on how we look at that idea of decreasing stigma. So what does stigma mean to you? Stigma associated with mental illness. What does that mean? Either the stigma itself, or what does it mean to decrease stigma? Excuse me for sipping coffee while people chat. Okay, well, Jackie gets the award for being the first one in chat, so we'll see who comes in second. Okay, where it's not socially acceptable or understood in society. Good, interesting perspective. So you're defining it more from the standpoint of the society. Very interesting. Okay, good point. Any other thoughts? Krishna, I'll call on you. And where it's not talked about in different cultures, like it may be kind of a taboo in some cultures. Society places shame on people who live with a mental illness. Very good, Venice. I'll give just a minute in case anyone else has a thought. Self-stigma, there is something else wrong with me in this system. Very interesting point, Henry. Okay. Well, I'm going to give this group gold stars because a lot of times when that question's put out there, people see frame stigma. People with mental illness are considered different. Yes, that does happen. And that's, again, like by everybody else. Gold stars to all of you all. This is, I just want you to think about this. A lot of times when that type of question is put out there, and you guys know I'm a recovering mental health provider, so I'm talking about myself too. There tends to be a tendency, especially among mental health providers, to think that person with the mental illness, they have a stigma about mental illness, and that's keeping them from going to get help. Now, chances are, from what we talked about the slide before, it may be that they don't even know that's what's going on with them because of the way their brain is working. And the symptoms themselves may make it really hard to think, and now I need to go out and find some help. It's not typically just about them. And also, I want you guys to think about, if you hear people talk that way, is it really fair to think there has to be this threshold that people have to realize they have a mental illness before they can get help for it? Or should things just be set up in a way so that it's easier for people to get the mental health support they need? So I encourage everyone, when discussions about stigma come up, to think about more, it's not the person. If we start focusing on that person has a stigma about their mental illness and they need to get over it, we're blaming them for their mental illness. But I really like what you guys said about, it's really a bigger picture. It's a societal thing. And we need to look at, is our system itself making it more stigmatizing to get help for mental illness? So I'm going to pause for a minute. Do you guys have any thoughts about that? Is our system itself stigmatizing about mental illness? Any thoughts about that? Okay, I'm going to let you all keep pondering, but I'm just going to throw a couple ideas out there. Oh, wait, you got one. At times, yes, doctors, family members, etc., may say, just get over it, or it's not important to look further into for help. Yeah, so you may be made to feel like, why should I even go try? It's because there's not a general public awareness. And then some systems feel people with mental illness can't think for themselves. That's very true. Good point, Karina. And sometimes even the mental health system can be the worst offender on that, because there may be a lot of preconceived notions about what a person with mental illness can and can't do. Having a mental illness doesn't mean that you're not you, or that you can't think for yourself. The idea that you have to go to another place is for mental health services stigmatized to me. Very, very good point, Nikki. Other kinds of healthcare and support are usually available, at least the initial part of it, through wherever you get your medical care, so that you don't have to go to a separate place. First of all, let's just imagine if you have your doctor or your nurse practitioner, whoever you see, you can imagine them in your head for your regular health care. What if they didn't check your heart and you had to figure out for yourself, because there was a heart disease awareness week, that you needed to go to another doctor to get your heart checked, instead of your regular doctor just checking and listening to your heart? But that's what we do with mental health. Now, things are starting to change where primary care doctors and nurse practitioners are getting the support and information they need to ask people about their mental health and ask about certain symptoms and be able to treat those symptoms if people have them. But up until now, it's been about like being told you need to go, you have to figure out for yourself that you need your heart checked, that someone needs to listen to your heart, and you have to go find that system. So that's very stigmatizing. And then think about children. They often get their eyes and their hearing checked at school. And then they can get some initial follow-up support for that or some ideas about their families, where to go. If a child gets sick at school, there's often a school nurse. If a child has a medical condition like diabetes, I know this from living at severe food allergies, there's a nurse at the school that can help manage those kinds of things and help that child. We don't really see that as much with mental health. We're starting to, but why shouldn't children be able to get that kind of support where they already are and not make their families feel like you've already been exhausted by everything that's happening? Now you have to go out and find these other services. So good points. This group continues to get gold stars. All right, now let's talk about Mental Illness Awareness Week. And all these things are hyperlinked. I've got another comment. I don't want to leave anyone out. Some of the settings are not up to par like most medical offices. That's a good point. This can make people trying to access services feel that they are less and stigmatized as less important or worthy. That's so true. Yeah, some of the clinics and some of the places you have to go are pretty beat up and run down. That is very true. And the care, yeah. And it's not necessarily like going to get your medical care. Very good point. Now, if those services are co-located, that would be really helpful because that would address that kind of issue too. The services would already be there, and then they would be in a setting that was more user-friendly. So Mental Illness Awareness Week was established by Congress in 1990, and this year it's October 3rd through 9th, and I think we're on October 8th. Now, we as an organization appreciate the National Alliance on Mental Illness, which is called NAMI, especially the Mississippi chapter, they're a partner, for spearheading this effort in partnership with other groups. So this week has been spearheaded by NAMI since its beginning, and they may have been the ones that went to Congress and got it established. The goal of the week is to raise awareness of mental illness, fight discrimination, and provide support. So the kinds of things we've been talking about. This just gives you, and a lot of you are probably familiar with these statistics of why this matters, because this affects us all. 1 in 5 adults, 1 in 6 youth has experienced a mental illness or mental health disorder this year. And all of those people have families. So, and then you can see some groups are more likely to have experienced mental illness, like the LGBT community, not because there's something wrong with them, but because of some of the discrimination and barriers that go with that. Same with mixed and multiracial adults. So you can see some of these things that happen. Now, some of the lower rates in people of color, that may get back to what Karina was talking about. It may be harder for some groups for mental illness to actually be identified because it's not something that's as comfortable to talk about. We don't know why those lower numbers are there, or it may be that they were not able to access the treatment they wanted or needed because of barriers or discriminations. They weren't able to be, so then they weren't counted. Or it could be that there's lower rates of incidents in those groups, but you can see it's still prominent. Now, these are just some prevalence rates by condition for adults. And it's interesting that the most prevalent disorder is anxiety disorders. I don't know that people would have necessarily guessed that. That's probably not as true for children, since things like ADHD would probably be the most common disorder among children. I couldn't find any vetted statistics on that, but so you can see that. And these are just some helpful NAMI pages. And again, we'll post this on the our website so that you can go back to these hyperlinks so you can get more statistics. Like if they've got a lot of different kinds of statistics about mental illness on their mental health by the numbers, which can be really interesting and informative. And then they have their illness awareness week landing page, which has some great information. And I would encourage you to go to that page and look at everything. But they have some videos on there of people talking about their own mental illness to help raise awareness. And one thing that I thought was really good is they have a person who is diagnosed with borderline personality disorder talking about her diagnosis. And I thought it was one of the most helpful videos as far as anyone talking about any disorder, the way she shared it. But borderline personality disorder and actually all of the personality disorders for a long time have kind of been the stepchildren of mental illness, that things like depression, schizophrenia, anxiety, bipolar disorder, people are more familiar with. This is going to sound weird, but they come across more as an illness, like people have this onset of symptoms, you can see the difference, all those kinds of things. And they typically are treated with medication. There are also personality disorders, and I'm not saying that that's the best way to label something, but that's what they're called in the Diagnostic and Statistical Manual of Mental Disorders. And those are more ongoing patterns of behavior and thinking and adapting that don't work well for people and end up causing problems in their relationships with other people. And they are only diagnosed in adults, so they tend to also greatly impact occupational functioning. They are one of those things that are particularly hard for people to realize that they have. So there may, actually be some brain alteration thing that makes it very hard for them to know they have it. And typically they have had a lot of problems, both with their relationships and with jobs. And if they're an adult in college or school, with school, because of what is going on, but they may have difficulty recognizing that there's any relationship. For many years in the world of mental health treatment, they were just kind of put off to the side and like, there's not a lot we can do about that. With one of the disorders, which is borderline personality disorder, and people with borderline tend to have difficulty like really figuring out inside of their head what their identity is, like who they are as a person. They tend to have very black and white thinking, like people are all good or all bad. They may have, self-harm. So people who cut on their arms and things like that, that may be a symptom of borderline personality disorder. They may get involved in substance abuse or other destructive behavior because, including the self-harm, almost as a way that it helps them realize that they are human. So they have a lot of really challenging symptoms to deal with. And for many years in the world of treatment, they were just kind of put off to the side, like nobody knows quite what to do with that. But in the past few years, there's been a lot of progress on being able to come up with treatments that actually help people with borderline personality disorder. So I was very glad to see this video on there, because in the world of mental health, that disorder has been stigmatized. Like, oh, that's the one you don't want to have, or, those people, there's just not much hope. But there is hope, and there are treatments that work. And I think it's possible because people with borderline personality disorder are very focused internally on themselves because they're dealing with these incredibly difficult symptoms. I don't know if this is going to be proven to be true, but I think there's trends showing that because they are so perceptive about their own feelings and focused on them because they're so difficult, they tend to have be able with the right kind of treatment and support to have a lot of insight and even to have a lot of empathy. So it's very, I know just for me, watching these many years of what's happened with people with borderline personality disorder, very gratifying to see that that's being recognized and there is hope and there are treatments that help. So that's one I'd especially encourage you to look at because it shows a real difference, because within the world of mental health, that disorder has been stigmatized, but to see a different approach to that. So I encourage you to look at that. And if you know anyone with borderline personality disorder, to give them, you might want to share it with them. Yes, Nikki's bringing up an important point. You've heard other professionals say anything on Axis 2 you can't do anything about. Yes, the way mental health disorders are diagnosed, there's Axis 1, and that's the things that we're most familiar with. And personality, what's considered the personality disorders, are diagnosed on Axis 2. And there is pretty much the thinking, and has been in the field, that those are entrenched, can't do much about them, that sometimes there's ways to find people to help people cope if they have enough distress from it that they're interested, but they've typically just been put to the side. That seems to be changing for borderline personality disorder. I don't know if it will change for the others. I've wondered, like, is this more like with borderline? Maybe what we're learning is we just didn't know enough in the mental health world. And now we know more and can help people with that. And with things like antisocial disorder, personality disorder, and narcissistic personality disorder, maybe in time, there will be more information learned to find out if those could be, if people could get help with those too. But my hat's off to NAMI, and my hat's off to the clinicians who have done so much work to get to the point where there is hope and help for people who have borderline personality disorder. And I've said that so much, I'm like tripping over the words. Okay. During this week, these are the days that are officially recognized. Now, just because we're past most of them, that does not mean, like, if you want to say a prayer for mental illness recovery and understanding, you can do that every day. Tuesday was a day people united around that. Thursday was National Depression Screening Day. We're going to talk more about screening. Tomorrow is NAMI Walks United Day of Hope. And then we'll talk more about World Mental Health Day on Sunday, which is not officially part of this week, but is tagged onto it. In our state, NAMI Walks Your Way Mississippi is doing a virtual walk. And they have defined it really broadly and have all these creative things you can do if you want to be part of that. And it's also a way to support NAMI financially. They are our partners and friends. So if you're interested, we've got the link there, or you can go to their website to see what they're up to. And it's also just interesting to read about what different people are doing for that day. Here are some places to get more information about mental health and screening for young children, because young children can have mental health challenges. You can go to 0 to 3's website and look at what to expect charts. And that tells you what a child at that age should be doing. So if they are not doing those things, especially in the social emotional arena, that may indicate some challenges. Same things with CDC Birth to 5 milestones. The Child Mind Institute has warning signs and a symptom checker for children ages 4 and up. That does not take the place of talking to a licensed professional. But if you're wondering, or if you're working with a family who's wondering what might be going on here, I just don't know, that can be a place where, especially that symptom checker, families can go in and see, is this something I should be concerned about, or is this age appropriate for my child? Then know the warning signs is one NAMI has about what are the warning signs of mental illness. Mental Health America has screeners for several different diagnoses, including depression, anxiety, bipolar disorder, post-traumatic stress disorder. An adult or older adolescent can go in and take them. There's also a parent screener. So if you think something is wrong, seems like it's wrong with my child, you can take that screener for your child and see. And if you have an adolescent, there's one they can take, like a younger adolescent, and older youth, like 18 to 21, can do the adult ones. But those are really good sources of screening. It is not a good idea to just go online and say, am I depressed? And then take some random tests that come back. They may or may not be accurate. Like, we've probably all at some point taken those fun Facebook quizzes, which are probably really trying to steal our identity or our data. But, to see, am I like the mellow, the mellow mauve person, or am I the, hyper green person, but those quizzes are just made up by people and they don't have any validity. But these are places where you can get actual information. You can also talk to your child's medical care provider and say, these are some things that are going on that I think might mean my child has a problem. What do you think? And see what they think. Now, that's good advice if you trust your doctor. If you feel like your doctor doesn't listen to you, we're not encouraging you to do that. But if you trust whoever provides your child's medical care, talk to them. Also, sometimes at your place of worship or your child's school, there can be someone who's informed. That may not always be true. So we're not saying go ask your child's teacher if you don't trust your child's teacher. But if you do, there can be places within church of worship in your child's school where they can help you get more information. Talking to a licensed mental health provider, and then reliable internet sites. And this link goes to sites that we've already vetted. So, and if there's a page, especially for parents, say like within the CDC or the National Institute of Mental Health, it goes to that page. So you can get more information. Again, we really discourage random Googling because you can get some information that's not accurate. But those are some places to get more information. Now we're going to talk about any thoughts or anything before we go on to World Mental Health Day. Okay. So World Mental Health Day was established by the World Health Organization. So it's a worldwide thing. NAMI is within the United States. And it was established in 1992. And it's this Sunday. The campaign theme for the day is mental health care for all. Let's make a reality. So that we can all get that mental health care we need. The campaign emphasizes the huge impact of COVID, and especially that it's had on mental health, especially that of frontline workers. But I thought this was interesting. It also emphasizes reason for optimism in how governments throughout the world have scaled up mental health efforts in response to the pandemic. So I guess that is, I don't know that it's worth it. I don't think it is. A small silver lining from COVID is that there are governments throughout the world who have realized we need to do more about mental health because of how we're seeing COVID affects people's mental health. The campaign stresses both system level advocacy and taking care of one's own mental health. Now, I can go to one of these and if it works. I'm going to try looking at one of these tip sheets if it will load. Okay, so this site has some really helpful tip sheets, and they're about depression and suicide. And you know how we said depression or any disorder can look different at different ages. So this shows you that on depression. There's a general tip sheet about depression, then one about during pregnancy and after childbirth, if you're living with someone with depression, because that can be really hard, what depression in children looks like. I'm not going to go through all these, but y'all can go back to them. What depression during the teens and 20s looks like, and as you get older. And then some tip sheets about suicide, both if you feel like life is not worth living or if you're worried about someone else. Are y'all seeing, well, let me switch. I'm just going to show you. Here's the tip sheet about children. So it just gives some helpful information. And, you know, when we talked about depression, doesn't always look like sadness, a headache or stomach ache, persistent crying or difficulty being away from you can be a sign of an emotional problem. Loss of interest in play, irritability, and difficulty concentrating are other signs. It's rare among young children. It's much more common among older children and teens. That doesn't mean young children can't be depressed. They can, but, and then it gives practical tips of what you can do. Right. So there's several. Okay, so now we're going to go back to our slides. And this is more at the systems level. But the World Health Organization has a comprehensive mental health action plan, and they're not kidding when they say comprehensive, and it was just updated. And it relies on, so this is a plan for how countries around the world have come together and said, these are the things that we think are important to be able to address mental health across the world and to support people with mental illness. There is so much in that plan, but I just want to point out a few highlights from it and see if it helps you think about anything in Mississippi. The action plan relies on 6 cross-cutting approaches and principles, and we're going to go through those real quick. The first one is universal health coverage. Now, regardless of age, sex, socioeconomic status, race, ethnicity, or sexual orientation, and following the principle of equity, persons with mental disorders should be able to access, without the risk of impoverishing themselves, essential health and social services that enable them to achieve recovery and the highest attainable standard of health. Now, sometimes when people see universal health coverage, the first thing they go to, and I'm not saying this isn't important, is Medicaid expansion. That is definitely a conversation that needs to be had. But one thing we know in Mississippi, because this came out in the recent lawsuit trial, is that even with the way Medicaid is structured now, not enough is being done to make sure that everyone who currently qualifies for Medicaid is actually getting it. And for services that are paid for through state dollars, like for crisis centers and things like that, are those people who most need those services able to get them? So things like that. So there's a lot of things we can look at in Mississippi, and keeping in mind that people should not be at risk for impoverishing themselves to get services, and that these services should enable them to achieve recovery and the highest attainable standard of health. So it's not just that these services should get them some medicine, or these services that should get them an appointment with someone who may or may not be partnering with them to help them get what they want, but these services should help them be able to achieve the goals they want to achieve, to be as healthy in every way as they can. So that's the first one. And then human rights. Now just listen to this. I want everyone to listen and think, and does this remind you of anything in Mississippi? And remember, countries around the world have come together and agreed on this. Mental health strategies, actions, and interventions for treatment, prevention, and promotion must be compliant with the Convention on the Rights of Persons with Disabilities and other international and regional human rights instruments. Can you think of anything that's going on in Mississippi that might be related to this one? And I'm going to sip coffee and give y'all a second to chat. Anything in Mississippi? That has to do with the rights of people with disabilities. Are we good in Mississippi on the rights of people with disabilities in the mental health system? We are not good. We are not good. Yeah, we are not good. And we have a whole lawsuit that has been going on for 10 years in our state. Yeah, Karina, good job. That is based on the Americans with Disabilities Act. Can people with mental, and the Olmstead ruling, can people with mental illness live in the community and reach the goals they want if they want to? Yeah, that's why we are being sued. That's why this, not we, the state is being sued, exactly, because we have a lot of issues here. And, right now, what the state is saying is that as long as they provide services, or as long as they fund the services and have the capacity to provide them, they shouldn't be judged on whether or not they're actually providing them. That doesn't really fit with this. So I just thought that was interesting. Evidence-based practice. Mental health strategies and interventions for treatment, prevention, and promotion need to be based on scientific evidence and/or best practice, taking cultural considerations into account. So people have the right to ask, if they're receiving mental health treatment, are you using evidence-based practices to help me? And if so, what are they? And it's okay to ask those things. We encourage you to ask those things and encourage other people to ask those things. Interestingly, one of the places to find out what evidence-based practices are offered in a state is through the Psychology Today website. I didn't put that on here, but that can be a resource. And each of these, we could have its own, it could have its own webinar, but policies, life course approach, plans, and services for mental health need to take into account of health and social needs at all stages of the life. So it needs to start, these things and the services and supports in a country need to include infancy, childhood, adolescence, adulthood, and older age. So it needs to go across the lifespan and be responsive. Now we're coming towards the end. And a multi-sectorial approach. Comprehensive and coordinated response for mental health requires partnership with multiple public sectors, such as health, education, employment, judicial, housing, social, and other relevant sectors, as well as the private sector, as appropriate to the country's situation. It's basically talking about all those systems working together, which is what we've been striving for through a system of care approach for years. But those systems remain pretty siloed. But here's all these countries in the world coming together and saying, this is what we should do. So it's not just something that would be a good idea for Mississippi that a few of us are talking about. There are governments throughout the world who are saying, yes, this is the only way to really design a mental health system that's going to work. This is a biggie: empowerment of persons with mental disorders and psychosocial disabilities. Persons with mental disorders and psychosocial disabilities should be empowered and involved in mental health advocacy, policy, planning, legislation, service provision, monitoring, research, and evaluation. Does that sound like anything we've already heard in this presentation? Does this remind you of anything? And I may cheat and answer this one myself because of time, but this pretty much mirrors the definition of family-driven practice. So we use a definition, the family-driven practice, that's nationally accepted, and also governments around the world have adopted a similar definition for people with mental health challenges in general. So that those people should be involved in every level of things that happen. And you can read the document and their families. These are some specific ways that should happen according to what all these governments agreed on. The first one is about funding and to build the capacity of people with mental disorders and disabilities and their organizations in understanding and advocating the realization of human rights conventions, policy, law, and services based on needs and preferences. So they're talking about making sure organizations like ours exist and are funded and are able to look at policies, laws, and services. Encourage this and support the formation of independent national and local organizations of people with mental disorders and disabilities, and establish formal mechanisms to ensure their full and effective participation in the development and implementation of policies, et cetera. So organizations like ours should be supported. That according to this, there's a lot, governments came together and agreed on that, and that they should be independent. We shouldn't be doing what, the state government thinks. We're not their spokesperson. We should be independent because we're representing and are made up of the people. Involve people with mental disorders and psychosocial disabilities in the assessment and monitoring of all public and private mental health services, including psychiatric hospitals and social care homes. So it's community-based services. Include people with mental disorders and psychosocial disabilities and their organization in capacity building of stakeholders, including policymakers and health workers delivering mental health care. So people and families should be influencing policymakers, becoming policymakers, and also helping deliver the services. So that's just a lot of reinforcement for what we're doing. Okay, we're at the end. These are the things we said we do. And I know I think we're right at 11. Does anybody have any closing comments you want to share? I know we, as always, covered a lot, and you can look and see if we covered what we said we would. And then there's our information. Okay. Any closing thoughts? All right. I really appreciate everyone being here today. Thank you.